When should you use ice versus heat for an injury? My name is Bhavin, and I'm a Master's of Physical Therapy student at Western University. Here's the science behind when to use which. So, ice is acting as something that's going to constrict the blood vessels to slow blood flow and help with inflammation. It also helps numb the pain. So, the key with ice is to use it within 48 to 72 hours to really help with swelling, bruising, inflammation. So, any sprains, strains, or impact injuries, or after surgery, it's a good idea to use it. However, with ice, we want to make sure we don't put it over any bony areas or areas that have any superficial nerves or any open skin, or areas where you have poor circulation or sensation. So, if you have diabetes or neuropathy, etc., and we want to make sure we don't ice for too long. So, generally, the parameters that we are taught is we want to ice for only about 10 to 15 minutes, and we want to check in after 5 minutes. And then once you've done that and you've cooled it down, let the tissue warm up again, give it a few hours before icing again. And next, let's talk about heat. So, heat is acting to vasodilate or increase the blood flow to relax the muscles and improve mobility. Just remember, neither of these is fixing the root issue, but they can help manage pain. So with heat, we want to use it more for chronic pain, stiffness, muscle tightness. So things like osteoarthritis, it can be useful, but it depends with OA. Use what you feel helps you more. But things like low back pain, tight neck or shoulder or any other muscles before activity or stretching to loosen tissues. But we want to make sure we don't ever apply heat to areas that are swollen or inflamed. And we avoid applying it to open wounds, infections, if you know you have any tumors or anything like that, or are at risk of hemorrhage or recent bruising. And we need to be cautious in if you have like poor sensation or circulation. So again, with diabetes or peripheral artery disease. But here's the takeaway. If it's red, swollen, or recent, generally ice. If it's stiff, achy, or chronic, heat. And remember, these are just pain management strategies. The real solution is movement, continue to strengthening, and using like a physio-guided rehab for whatever your true injury is. And as always, if you need a personalized healthcare plan, be sure to see a physiotherapist or a healthcare professional.